There's real fear among the doctors and nurses and healthcare workers in a way that I really haven't seen before. So, most of the diseases by far that we treat are, not that infectious, and especially for the other specialties, you're just fixing an appendectomy, doing an appendectomy to fix the appendix. You're giving vaccination shots to children. You're doing things that, or fixing a heart attack or an MI. So these things are not a danger to you. But this disease is so infectious that, every time you're going out to help a patient, you're putting yourself at risk to get infected yourself. And if you get infected yourself, you may get sick of the disease, you may die of the disease, but you also may now infect your family and your friends around you. So this now stress and this awareness and this knowledge adds a whole other layer to medical practice that, makes this, a real sport now. This is now like, my skin is in the game, my butt's on the line too if this doesn't work out well. So it does mean that doctors are being more aware, are being much more careful, and are also, asking for protection, and I think that's what we really need to help them with at this time, is to say, yes, we have given you enough personal protective equipment to make sure that you're not gonna get sick from this disease, as well as your patients. One of the things that we need as healthcare workers is the PPE, the personal protective equipment. So we need the masks. So what I'm seeing happen in America, for example, is that a lot of people are using the N95 masks or surgical masks in public that was really needed on the front lines in the hospitals. And so there was a call out there to say, look, wear masks, wear cloth masks, make these masks yourself. But these medical masks, please preserve them so that our healthcare workers can use them, because they're at highest risk by far, because they're dealing directly with the patients who have the virus and the disease. So preserve the mask usage, wear cloth masks, but don't use those equipment that would otherwise be used, in the hospital and on the front lines for healthcare workers. I think the other thing too is to, what I'm seeing is great demonstration of support of healthcare workers around the world. There's, photos of people in Spain clapping for the healthcare workers, and really supporting them, because it is very stressful for them. So that, the people, the Wananchi in Kenya are now really supporting them and saying, yes, we will help you. We support what you do. We realize you're fighting this for all of us. I think this is great and really buoys the spirit of the doctors and the nurses and the healthcare workers to say, okay, people are really backing me up. What we don't want to have, and what I've seen and read about in instances in India, is people now throwing these healthcare workers out the door and saying, I don't want them to live next to me. I don't want them to be in my same apartment. I don't want them, that's really not going to be helpful. And you're really kind of shooting yourself in the foot by treating these healthcare workers that way. And again, that fear is understandable, but again, if you are preserving your masks, you're helping them stay protected in that end, the risk to you is very small, but the benefit is very great that they're going to actually contain that disease and make sure that they're around to treat you if you get sick.